Look at the back of your hand right now. Hold it up. Now turn your arm over and look at the soft skin on the underside of your upper arm up near the armpit. Same body, same years, same person, alive for exactly as long. And that skin is almost certainly clear. So whatever is putting those brown patches on your hands, plain age is not doing it on its own. If age alone made spots, they would be everywhere on you. They are not. They are on your hands, your forearms, your chest, your face. They are sitting exactly where the light has been landing on you for 60 years. I'm Dr. John Myers, and I want to give you 5 things about those spots that most people are never told. Not because your doctor doesn't care, because of how the visit works. You point at your hand, your doctor glances at it, says that's benign, that's just age, and moves on to the next thing on the list. And they are right. Usually hold on to that word because the 5th thing is about the spot that isn't. But benign and permanent are 2 different words, and somewhere along the way, they got collapsed into one. And before you click off because you assume this ends with wear more sunscreen, sunscreen is on the list. It is number 3. And the part almost nobody tells you about it has nothing to do with sunburn. Here is what one of those spots actually is. Down at the base of your skin sit pigment cells called melanocytes. They make melanin, the brown pigment, and they hand it up to the skin cells above them. That is normal. That is a tan. 2 things have to go wrong for a tan to turn into a permanent brown patch. The first is signal. Melanocytes only make pigment when they are told to, and the order runs through an enzyme called tyrosinase. Tyrosinase is the on switch. Ultraviolet light flips it, so does inflammation, so does oxidative stress, which is the slow chemical wear that builds up in every tissue you own across decades. After 60 years of that, a handful of those cells sit with the switch stuck on. They keep producing pigment long after they should have stopped. The second is clearance. Your skin replaces itself from underneath. Old pigmented cells rise to the surface, flake off, and carry the pigment away with them. In your 20s, that cycle ran about a month. By your 60s, according to the National Institute on Aging, it is closer to 2 months, sometimes longer. So pigment that used to be gone by Christmas is still sitting on your hand in March. Too much signal, too slow clearance. That is a spot. And every treatment that has ever worked, from a $15 bottle to a laser, does one of exactly 2 jobs. It turns the signal down or it speeds the clearance up. Keep those 2 words in your head because I am going to score all 5 things against them. So, what is coming? An enzyme you can switch off with a bottle from the drugstore. A prescription cream that has been sitting in the New England Journal of Medicine since 1992 and is almost never offered to anyone over 65. A sunscreen mistake that has nothing to do with burning. And at the end, a test you can do with one fingertip in about 10 seconds that tells you which of your spots are harmless and which one you should have looked at this month. One quick thing first, then I will leave it alone. Everything I am about to tell you about your skin is really a story about what is happening underneath it. Oxidation, low-grade inflammation, repair that runs slower than it used to. That same story is running in your arteries, in your joints, and in your brain at the same time. Your skin is simply the only place you can watch it happen. So I took everything I tell my own patients about that and I put it into one simple plan for living longer, stronger, and healthier after 60. Thousands of people are using it already. The link is on your screen. Look at it or don't. Either way, let's get to number 1. Number 1, what those spots actually are and what they are not. Start with the name. The real name is solar lento, solar from the sun. Somewhere in the last century, people started calling them liver spots, and your liver has nothing to do with them. Nothing. Your liver is fine. That name has been quietly worrying people for 100 years over a mistake. They are not a disease. They are not cancer. What they are is a record. Every one of those spots marks a place where the light landed on you more than anywhere else, which is why they show up on the back of your hands and never on the back of your knees. Your hands have been on the steering wheel, on the garden fork, on the arm of the chair by the window, out in the light for 60 years, and a record can be edited. The cells that made that spot are still alive and still taking orders. They have not turned into something else. They are overproducing, and the pigment they already made is stuck, which means both levers, signal, and clearance are still sitting right there for you to pull. None of that gets said at the appointment, and it isn't laziness. There is no billing code for sitting down with a 68-year-old and explaining pigment regulation. Insurance files these as cosmetic, which means that inside the plumbing of the system, they belong to nobody, so they get a shrug. They should not get a shrug. One exception, and it is worth a minute of your time. Not all pigment on older skin comes from light. A handful of common medications can darken skin all by themselves. Amiodarone, a heart rhythm drug, monocycline, an antibiotic people take for months at a stretch, hydroxychloroquine, certain chemotherapy agents, some anti-seizure medications. If your pigment showed up fast in months rather than years, and if it turned up in places the sun does not reach, take your medication list to your pharmacist and ask them straight out whether anything on it causes hyperpigmentation. It is a 2-minute question. It is free and almost nobody thinks to ask it. Number 2, the enzyme has an off switch and it costs about $15. Tyrosinase, remember, is the on switch for pigment. There are ingredients that block that enzyme directly, and you do not need a prescription for a single one of them. Neoinamide, that is vitamin B3 in its active form, and it is the one I would start with. It works a little differently from the others, and this is the part 1, like it does not attack the pigment cell. It blocks the handoff. The melanose still makes its melanin, but it cannot pass it up into the skin cells where you would actually see it. The research on this was published in the British Journal of Dermatology, and dermatologists have leaned on it ever since because it is about as well tolerated as any active ingredient gets, 5% every night. And it calms inflammation and rebuilds the skin barrier while it works, which matters a great deal if you are over 60 and your skin has gone thin and dry on you. Oleic acid blocks tyrosinase, and it is anti-inflammatory. On top of that, if your skin is sensitive and turns red at everything, this is usually the kindest one on the shelf. Vitamin C in a stabilized form in the morning. It blocks the enzyme and it soaks up oxidation at the same time. So it is hitting the signal side twice. Now the honest part, because I am not going to sell you a miracle. These are gradual. You are looking at 8 to 12 weeks before you see a real difference. And what you get is a fade, not an erase. Anyone who tells you a cream will wipe out a 40-year-old spot in 2 weeks is lying to you. And you should walk away from that counter. And one thing on the inside of this, the signal does not only come from sunlight. Chronic low-grade inflammation keeps tyrosine switched on too, which is why older skin that gets injured, a bug bite, a scrape, a burn from a hot pan, a patch you kept scratching, will often leave a brown mark behind that lingers for a year. That is called post-inflammatory hyperpigmentation. So do not pick at your skin and do not scrub it. One more, and I want to be careful here. Hydroquinone is the most studied skin lightening agent there is, and it does work. But the FDA has stated plainly that over-the-counter hydroquinone products are not FDA approved, and in 2022, the agency sent warning letters to companies still selling them. One of the concerns is a permanent blue-black staining of the skin called ochronosis. Prescription hydroquinone under a doctor's eye for a defined stretch of time is a legitimate tool. A bottle you buy off a shelf or a website is not one I would put on my hands. Quick pause since we are halfway. If this is landing, take a second and subscribe and hit that like button. It genuinely decides whether YouTube shows this to the next 68-year-old who has started hiding her hands in photographs. And put your age in the comments because it shapes what I cover next. Alright, number 3. And this is the one where most people are quietly undoing everything else they do. You have been told to wear sunscreen. Fine. But that advice has been delivered badly for 40 years because it got tied to sunburn. And if you are 65 and you are not burning, you assume the message is not aimed at you. Sunburn is ultraviolet B, UVB. It is what turns you pink at the beach. Pigment is largely driven by ultraviolet AUVA. The longer wavelength UVA does not burn you. You will never feel it happening. It is nearly as strong at 9 in the morning in February as it is at noon in July. And UVA passes straight through window glass. In 2012, the New England Journal of Medicine published a photograph I have never been able to forget. A 69-year-old man who drove a delivery truck for 28 years. The left side of his face, the side that sat by the window, is deeply lined, thickened, and mottled with pigment. The right side of his face looks 20 years younger, same man, same age, same genes, same diet. One side of him simply sat in the light coming through a pane of glass. Your car window is doing that to you. The window over your kitchen sink is doing that to you on the gray days too, because UVA barely notices cloud. So the instruction is not wear sunscreen at the beach. It is broad spectrum SPF 30 or higher every single morning on your face and on the backs of your hands. The hands. Almost nobody does the hands. And the hands are exactly what you are looking at when you decide you look old. And here is the version most doctors will never get to. Visible light, the ordinary daylight you can see with your eyes, also drives pigment, and standard sunscreen does not block it. Iron oxides do. That is what the word tinted means on a bottle of mineral sunscreen. If pigment is your problem, tinted mineral sunscreen with iron oxides is the bottle to buy. Skip this step and every other thing on this list is being undone each day faster than you can do it. Signal down. That is number 3's whole job. Confident. Number 4. The treatments that already exist and why nobody has offered them to you. Now, we are on the clearance side. And this is the section where I want you to get a little bit angry because none of this is experimental and none of it is new and it is almost never mentioned to people your age. Start with the cream teninoid, a prescription retinoid, a vitamin A derivative, and it does exactly the thing your skin quit doing on its own. It speeds cell turnover up. So the pigment-loaded cells at the surface get pushed off faster than they are being replaced. In 1992, the New England Journal of Medicine published a trial from the University of Michigan on topical triatino for exactly this problem: liver spots, sun-damaged skin. After 10 months, most of the treated patients had visible lightening, and a large share of their individual spots faded while the placebo group largely did not. That trial is more than 30 years old. It is one of the most solid pieces of evidence in all of dermatology, and I would guess it has never once come up at your appointment. There is a weaker cousin you can buy without a prescription called retinol. Same pathway, slower. Start there if you cannot get a prescription and start slow with either one. 2 or 3 nights a week at night only because both of them will peel and sting your skin if you rush them. And both of them make you more sensitive to light, which is precisely why number 3 is not optional. Then there are the procedures, and this is where people your age get quietly written off. Cryotherapy. A few seconds of liquid nitrogen on the spot. Pigment cells are more vulnerable to cold than the skin around them, so they go and the skin stays. Cheap, fast, done right there in the office. Intense pulse light and the Q switch laser. Light energy tuned so that the pigment absorbs it and nothing else does. The pigment shatters and your own immune system carries the fragments away over the following weeks. For established solar lentes, this is the most effective thing that exists, and there are chemical peels which take off the top layer under control. None of that is dangerous in trained hands. None of it has an age limit written on it anywhere. And yet, how often is any of it laid out as a real option for a woman of 70? Almost never. Part of that is the 12-minute visit. Part of it is coding and money. And part of it, honestly, is an assumption that somewhere along the way, you stopped caring how you look. You did not stop caring. Wanting to see a photograph of yourself and recognize the person you still feel like on the inside is not vanity. Every patient who has ever said that to me said it apologetically, and not one of them should have had to. Number 5. And this is the reason I made this video. Not every brown mark on your skin is an age spot, and you can sort most of them yourself right now with one fingertip. Close your eyes and run your finger slowly over the mark. You are not looking at it. You are feeling it. Flat. Perfectly smooth. Your fingertip cannot tell it is there. Only your eye can. That is a solar lentigo. That is the age spot we have spent this whole video on. And it is harmless, rough, gritty, like a small patch of fine sandpaper, often easier to feel than to see. It scales, and if you pick it off, it comes right back a few weeks later. That is not an age spot. That is an actinic keratosis, and it is a precancer. Cleveland Clinic and Mayo Clinic both put this plainly. A small percentage of these become squamous cell carcinoma, a genuine skin cancer if they are left alone for years. And nobody can tell you in advance which one it will be. That is exactly why they get treated. A few seconds of liquid nitrogen, and it is finished. If you have a rough, gritty patch on your scalp, your ear, your forehead, or the back of your hand, do not sand it, and do not moisturize it and hope. Get it looked at. Raised, waxy, slightly greasy, sitting up off the skin as though somebody stuck a piece of candle wax on you and you can almost catch an edge of it with a fingernail. That is a seborrheic keratosis. Common after 60, harmless, and it can be frozen or shaved off if it bothers you. And then the one that matters most. Any spot that is changing, growing, ragged, or blurred around the edge, carrying more than one color in it. Brown and black or brown and red, wider across than a pencil eraser and still getting wider. A spot that itches or bleeds and will not heal, or a dark streak that turns up under a fingernail or a toenail. That is the ABCDE list from the National Cancer Institute, and here is why it belongs in this video. One form of melanoma called lentigo maligna begins life looking exactly like an ordinary age spot on the sun-damaged face of an older adult, and it spreads sideways slowly for years, while everyone around it keeps calling it an age spot. I am not telling you that to frighten you about your hands. I am telling you this. That's just age is a conclusion. It should be somebody's conclusion after they have looked and never the reason nobody looked. If one spot on your body is different from all your other ones, that is the spot you take to a doctor. Dermatologists have a name for it. They call it the ugly duckling sign. The odd one out is the one that gets checked. Fine ever. So, 5 things and what to do with them this week. 1. They are solar lentigens. The liver has nothing to do with them. The cells that made them are alive, and they are still taking orders. 2. Tonight start a 5% niacinamide serum. After you wash your face, before your moisturizer, and on the backs of your hands, not just the face. Then leave it alone for 8 to 12 weeks before you judge it. 3. Tomorrow morning, broad spectrum, SPF 30 or higher, face and hands, tinted mineral if you can find it, every day, including the cloudy ones, and the days you are only driving to the store. 4. At your next appointment, say these words out loud. I would like to talk about treating the spots on my hands. Ask about tininoin. Ask about cryotherapy. Ask about IPL. You are allowed to ask. And if you get it's just age, ask again. 5. Do the fingertip test tonight on every mark you can reach. Smooth is fine. Rough and gritty gets seen. Changing growing more than one color or bleeding gets seen this month, not next year. And the honest timeline because you have earned it with the creams. 12 weeks to a real fade. With a procedure faster. With sun protection, you are not undoing a thing. You are stopping the next one from ever forming. And that is the least dramatic and the most valuable item on this entire list. If this was useful, subscribe, hit like, and tell me in the comments which of the 5 you are actually going to do this week. I read them. You have spent a very long time taking care of everybody else. Tonight, take 20 seconds and put something on the backs of your hands. Take care of yourself. I'll see you soon.